start that recording. Okay, and then from here, I am going to monitor the chat as I usually do throughout the talk, but today we'll be having Dr. Erin Howie speaking on the introduction to exercise as medicine, so I will pass it off to her.
Thanks, Angela. And I will say this is my first time Zoom screen sharing, and any of you who caught the gist of this, our Wi-Fi is being a little temperamental today. So bear with us, but hopefully we'll get our nice half-an-hour lunch talk in. So I'm gonna go ahead and share the slides.
We do want to ask anyone who may have their microphone on to just turn it off for the duration of the talk, please.
All right, can you see them in presentation mode?
Yep, you're good to go.
All right, perfect. So thanks for joining us. A little bit of a change in what we've been learning about, from nutrition to the other end of the energy balance equation, talking about exercise. So I'm Dr. Erin Howie, and I am an assistant professor in exercise science within the Department of Health, Human Performance, and Recreation at the University of Arkansas. And thanks to Dr. Baum for including me in on this project. It's really exciting. So today we're just really going to talk, get us all on the same page about some terminology related to physical activity and exercise. Talk about what are the U.S. physical activity guidelines for some of you that may be review. For those of you who aren't 100% sure what they are, I expect that, because even my husband has a hard time keeping track of what they are, and that's my job for a living. So some of the messaging can be a little confusing. And then we'll talk a little bit about why physical activity is important, especially in today's terms with COVID-19. And I'm going to share some really good resources. This is just a really brief introduction on physical activity and the benefits of it. But if you're looking for more details, there's some really good sources out there. And this is all leading into next week, when we'll get more into some examples about how we can meet those physical activity guidelines and how we can be healthy all around. So here are some of those sources. So the U.S. National Physical Activity Guidelines, they have a website, but two of the resources that I really like to use are the scientific committee reports. So there's one from 2008 and one from 2018. And a bunch of really, really smart people in this field have basically looked through all of the research and summarized it on the benefits of physical activity. So how can physical activity improve our risk of dying from anything? How can it improve cardiovascular health, mental health, basically anything that you can think of, and it summarizes it. The 2008 report, I find it a little bit more user-friendly. So if you're interested in a specific condition like cardiovascular health or mental health, you can find it there. And 2018 really emphasizes some of the new research that's come out. And I will also give credit Dr. Robert Salas. He's an MD out in California. He is really the spearhead of Exercise as Medicine initiative, which I'll go into more detail about. But he has some really good slides, particularly for approaching the healthcare sector, but I think anyone can relate to them. And he has kind of granted free use of his slides to anyone to kind of spread the message about why physical activity and exercise is important. So just to get us on the same page, and I will use these interchangeably, but when we talk about physical activity, it's really any bodily movement that you're doing. So if I go to stretch your arm, that's not physical activity, it's physical activity for me. Whereas exercise has a purpose. So this is something that's planned, structured, and usually we're doing it to become healthier. So an example of a physical activity, my students in undergrad classes, they always like to think of vacuuming as a good example of a physical activity that's not exercise. I'm not really sure how many of them vacuum regularly, but that's okay. And exercise are the things that we think about going to the gym, going for a walk, going for a jog, lifting weights. All of those are exercise. And even the term exercise is medicine is a bit of a misnomer, because what we really talk about and what we really want people to do is physical activity. We don't care why they're doing it. We hope that they do it for their health, but you know, vacuuming is great. Carrying in the groceries, that's great too. Going to Walmart, pushing things in the cart, that's a great physical activity that gets the same health benefits. And both physical activity and exercise confer those same benefits. And sometimes when you say exercise, people don't like that word. It can be a dirty word to some populations because they think of, oh, I hate going to the gym. I don't like doing that. So we try and use physical activity as much as we can. And the last word there is fitness, and we'll talk a little bit about this at the end. But this is kind of that outcome from both physical activity and exercise. So it's basically that you're able to do the things that you want to do, which is good. And there's different components of fitness, which we'll talk about more next week. So I think this is a really relevant quote, especially in today's terms where we hear the word pandemic every day. But this was an issue from the Lancet Journal, which is a top medical journal from the UK, that came out in 2012, so 8 years ago. And it really highlighted how physical inactivity is a pandemic and some of the health and economic and environmental and social consequences that come from it. If anyone's interested, definitely check out this publication. They had another issue in 2016 in the Lancet of really highlighting why physical inactivity is so concerning for our health and economy, and give some ideas about what we can do about it. So Dr. Baum has showed a very similar chart to this in terms of nutrition and all the conditions related to it. But I just want to emphasize that physical inactivity in itself is also a risk factor, and not just as it relates to obesity. It can impact so many of the different chronic medical conditions that we're dealing with today. This drawing, I'll give credit to one of my students. We talk a lot about exercise as medicine and their interpretations of it. But these next slides I'm going to show you are from Dr. Salas, and really kind of making that analogy that if exercise was a pill, everybody would be taking it and it would be the best pill on the market. And then we get into questions about why people don't take it. So these are Dr. Salas's slides. I'll give him credit. And if anybody has been around healthcare professionals, you may have come across the physician's desk reference, which contains basically a list of all different medications, how to use them, side effects, etc. And so this is just kind of a hypothetical example of, well, what if exercise was an actual pill that you could take? What would it look like? What would it be listed in the PDR? So physical activity, it comes in lots of different forms, called lots of different things. You know, some people like walking, some people like biking, dancing, gardening. In our dose, we'll keep coming back to this, the magic number of 150 minutes, but we know that even if you get less than 150 minutes, you can still see a benefit. A lot of these drugs have implications for women who are pregnant or breastfeeding, but physical activity is perfectly safe for these populations. It can be used to treat almost any type of disease or disorder, especially chronic diseases, from mental health, cancer. You can use it recreationally, it's legal everywhere, and even decreasing the risk of premature death. When we're talking about side effects, yes, there are some side effects. Most of them are positive, and so affecting our cardiovascular health, improving our muscles, improving some of those mental health things like confidence and self-esteem, and just generally feeling better. We can't, promote exercise, physical activity as this magic cure. There are some potential adverse reactions. Sweating, I always include that because I work a lot with kids, and a lot of teenage girls do not like to sweat. It's true, people don't like it, something to deal with. Injury, Often this is due to overdose, but you know, if you're playing sports, most of us have dealt with some type of injury, but hopefully we can make things as safe as possible. And yes, there is a risk of sudden death, which is really sad when it happens, but there are a lot of measures that we can take to help prevent that, and some of our screening measures so that we can do exercise and physical activity safely. And there are lots of ways that you can give it in terms of forms. We can do it by ourselves, with others. We can increase it as needed, and you can do it indoor or outdoor. So it really is kind of this magical drug cure. This is back to that scientific report highlighting all the different benefits. So this is just a summary from the 2018 update. You can see all the different areas that physical activity has shown to help. And this is really not a totally inclusive list. It's just where the evidence is strong enough. So just because something's not on this list doesn't mean that physical activity can't help it. We just aren't quite sure. The research hasn't been done yet. So cardiometabolic, weight, cancer, brain health. A lot of new research has come out in the past 10 years showing how physical activity can reduce the risk of dementia, anxiety, improve the quality of sleep, as well as quality of life. It's important for individual or specific populations when we're thinking of age, so older adults, reducing fall-related injuries, and general physical function, and for kids as well. They have some unique benefits, improving cognitive function. And then it's not just healthy populations, even populations who have chronic diseases or other types of illnesses, they also see benefits from physical activity as much as that they can do. So general message, physical activity is pretty awesome, not just for obesity, not just for weight loss. It can improve a lot of other outcomes. And these are just a few of my favorite. I always get really excited when we talk about diabetes in class. Again, I'm probably more excited than my students, but you may be familiar with the diabetes prevention program. If you're not, I suggest you look it up if you're dealing with diabetes yourself or populations who have diabetes, because it really was kind of a miracle study. The original study, they took a bunch of people who were pre-diabetic, so they had high blood sugar, and they put them into 3 groups. One group they did nothing with. One group they gave them the drug metformin, which is the most commonly prescribed medication for diabetes, pre-diabetes. And then the third group, they gave them a lifestyle intervention, which was based on eating healthy, physical activity, and trying to get a 7% weight loss, which is kind of just an overall healthy lifestyle. And what they found was those who were in the lifestyle group, who ate healthy, did physical activity, lost a little weight, even if they didn't lose as much weight as they were supposed to, they cut their risk of developing diabetes in half. So they were even better, healthier than those who were on the drug, not to mention they didn't have those side effects. So it's really, I think diabetes is one of the issues where physical activity as well as nutrition can be most effective and have the most dramatic effects. One of the other areas that I've been looking more so into with my research is mental health. And so again, this is a summary from that 2008 report where they've looked at all of the studies that have ever looked at physical activity, exercise, and the effect on depression on the top, and then the feelings of distress and well-being on the bottom. And if you'll just see kind of that horizontal line, I don't know if you can see my arrow. I can't see my arrow, so it's not there. The horizontal line, if the box was there, there would be no effect. So if most of the boxes are above the line, that means there's a positive effect. If most of the boxes are below that line, it means they're a negative effect. And you can see that in both healthy and medical patients that physical activity has a positive effect on depression symptoms. So they've reduced their depression symptoms as well as improved distress and well-being. So take-home message, physical activity also has a large effect on mental health, particularly depression seems to be one of the most consistent findings. And this is back to Dr. Salas's slide. Why does it matter that physical activity can improve depression? We know that rates of depression are high and increasing in some populations. And when we look at the commonly prescribed medications for depression, medications only achieve remission in about 30% of people who are prescribed those medications. And then if you look at the cost of some of those most common medications, it's pretty high. And there are a lot of unwanted side effects that go along with it. So if we can have some type of treatment that doesn't have those side effects, doesn't cost as much, and it can also improve symptoms, then that's something we might want to try. So we are living in different times now, and one of the top health issues on people's minds are COVID-19. And some brand new research is coming out trying to look at how physical activity can impact whether we get COVID-19, how we deal with it, who are at most risk, what are the consequences. And so just following up on mental health issues, there was one study that came out of Australia that looked at physical activity decreasing during self-quarantine during these times. And they found that people who decreased their physical activity had higher depression, anxiety, and stress. So they're related, and those are things we want to avoid now in this pandemic. Cardiovascular risk, even short-term decreases in physical activity. So, you think a magic number of 14-day quarantine, those can have impact on cardiovascular risk. And this chart to the right, which these slides will be available on the DFEND website, you can see a list of all these things that change even within a few days. And lastly, again, back to my favorite miracle story of diabetes, we know that individuals who have diabetes are at a greater risk of having poor outcomes from COVID-19, but also COVID-19 and the general state of things contributes to worse diabetes outcomes. So that's a particularly vulnerable population that we need to help continue to be physically active. We have a fast fact already posted from DFEND 1.0 on exercise and immunity. But in general, this figure on the left just really highlights that moderate physical activity, so we're not saying running triathlons, marathons, Ironman, just meeting physical activity guidelines improves your immunity. And Jim Salas, who's kind of a physical activity and health guru out of California, he just did a talk about how physical activity impacts and is related to COVID-19. So the link is also there for the YouTube video as a great resource for anyone who's interested in that. So we know physical activity is important for health during COVID. Unfortunately, the newest research, so the first 1,000 participants who've done this international survey, the physical activity has gone down since COVID-19. And so it's something that we really want to pay attention to and help people get back to healthy physical activity levels. Using the term exercise as medicine, hopefully some of these examples, especially with mental health and diabetes, show you that exercise really is medicine. And so this is a worldwide initiative. It's spearheaded by the American College of Sports Medicine to help healthcare professionals see exercise as medicine, to prescribe it, to assess it when you go see your doctor. And their website has a lot of great resources for healthcare professionals if you're ever interacting with them, even example prescription pads that you can give out to patients. Physical activities and what should we be doing for our health? And like I mentioned, sometimes it can be a little bit confusing. So I like to break it down into the one number to remember is 150 minutes a week, sorry, that's a lot, of physical activity. This is moderate physical activity. So if you do higher intensity physical activity, 75 minutes, so you cut it in half. Or if you want additional benefits, you can double that. to 300 and 150 minutes. We also want muscle strengthening activities on 2 days a week. This can be lifting weights, but it can also be lifting cans of soup, putting away groceries, anything that is lifting some type of weight or your body weight, like sit-ups or push-ups. And we'll give more specific examples of that next week. Now for kids, there are separate recommendations. For kids, we think of elementary school age, high school age kids. We want to try and get them to do an hour a day of physical activity. Most of it should be moderate to vigorous, with including some vigorous. They should also do muscle strengthening and bone strengthening activity. But really, the main message is just emphasizing that 1 hour, 60 minutes a day. The new 2018 guidelines have added in some recommendations for younger kids based on the research, and generally they should just be active throughout the day. Other organizations have come up with more specific recommendations, but the US National Physical Activity Guidelines haven't put a specific number on it yet. I know a lot of individuals have asked some questions in DFEND about specific chronic conditions. You may work with older adults. The general summary from physical activity guidelines is that they should do as much as they can up to trying to meet the 150 minutes, but make modifications when necessary. Basically, some physical activity is better than none. We talk about moderate and vigorous physical activity. The easiest way to talk about them is the talk test. So if you're going for a walk, just a casual walk, and you can talk and you can sing, you're not really breathing heavy, that's light activity. If you can still have a conversation, but you're feeling a little bit huffing and puffing, that's moderate. And vigorous is when you can't really have that conversation. So thinking about running is a great example of vigorous physical activity. And like I mentioned, we'll go into a lot more detail about this next week. So these are just some quick results. And again, we've shared these slides with you about some of the information we're collecting at University of Arkansas on students, faculty, and staff, and how their physical activity, sleep, and this is their fitness results. So each of these is one of the health-related components of fitness, which again, we'll go into more detail next week. But you can see generally the green colors are good and the yellow colors are bad. So at the top left, we have aerobic fitness. We're not very aerobically fit. There's not quite so much green. Muscular strength and muscular endurance, we're okay. Our sample was really good at the push-up test, who knew? Flexibility, okay, and body fat, not so good. So about 3/4 of our population was considered unhealthy in terms of body fat. And that was all too high percent body fat. It is possible to have too low, but that was not the case in this study. So this is data that we're still collecting. Thanks of you who have already completed our survey. So the DFEND survey is also the same one we've been sending out to our students, faculty, and staff. And we're really just trying to get a status of where people are so that we can help them to be healthier. So if you haven't done it, you can still click the link on the DFEND website to take the survey. Encourage anybody in the community, they can also take it. And if you put in your email address, we will give you a report of your findings. And just be aware that, physical activity, it's not all nutrition. We want to talk about getting people moving as well. So next week, we're going to talk about how to meet those 150 minutes of physical activity, especially in our social distancing times. And of course, if you have any questions, concerns, interests, you are welcome to contact me directly, contact Dr. Baum, or through any of the DFEND channels of technology. But I don't know if there's any questions that have come up in the chat, or if anyone has some now, I'm happy to answer them in the last few minutes.
So there haven't been any questions so far, but if you have one, feel free to drop it in the chat with the few minutes that we have remaining. I did include a link to that pre-assessment survey that was just mentioned, so you can either link directly to that from the chat, or like she said, it's available on our website. And then I also included the link to our website at the top of the chat and our YouTube channel where this Zoom recording will be added.
Thanks,
And
Kaye.
the slides are added to the website. The recording is added to the YouTube channel.
And I will comment, typically when I present, I tend to include a little interaction from the audience. And Dr. Baum has given me the challenge of how to make our Zoom sessions a little bit more active. I have to do some rearranging. My desk is in my bedroom, so I'm a little bit more confined. But I promise you next week, be prepared to move a little bit. Not a lot, just a little bit.
There's a question, how long does it take to receive the assessment results after one completes and sends in the assessment?
That's a very good question. Usually we have our students do the report, and our students aren't back yet, but I'll have a conversation with Dr. Baum, where she wants to give the reports now or wait until we're done with DFEND 2.0. And we may be sending out an email just to our survey participants, whether or not, you want immediate feedback or we'll wait till December when we're done. But good question.
There's another question. After 300 minutes of moderate exercise per week or 150 minutes of vigorous exercise per week, are there any additional health benefits for doing more?
Yeah, that's a very good question. And that 2018 report, that was something that they tried to address. Because you'll see a lot of kind of the graphs that they show on the benefits of physical activity with any type of outcome, whether it's mortality, cardiovascular health, they kind of go up at the end. So when you get to those extremely high levels of physical activity, there seems to be, it's not an increased risk from no physical activity, but you stop seeing additional benefits. They wanted to put a number on that, but they couldn't based on the research. But it is those very, very extreme levels and usually of higher intensity. So when you think of, Ironman training, which is crazy, I know a lot of my friends have done that. That's when you start seeing some of the less benefits increasing from those extremes. But there is no magic number on it. For average people, walking, there's not any declines or reduction in the risk. You won't see as big of an increase once you reach those 300 minutes. But good question.
If there's any other questions, feel free to drop it in. We have a few more minutes. And then if you do want to have like a weekly reminder to sign up for each week's session or want to know what's coming, you can sign up for our newsletter. Those will go out on Thursdays, and the sign up is right on our website. Next week's topic is how to incorporate physical activity into your daily life.
And yes, Linda, I thought for a second you were Dr. Baum again. Yes, that's definitely a very good point, and we will try to get those turned around as quick as we can.
Someone asked, do you know any reason why someone who is exercising to the point of burning almost all calories being taken in would not lose weight?
Yes, that's a very good question. Dr. Baum is better at answering that, but the energy balance equation, it's not exactly calories in versus calories out, because all of our bodies have a different rate of burning calories. I would be very concerned if somebody was exercising as much as the calories that they're taking in, because we do need 1,500 to 2,000 calories a day, just not in terms of physical activity. So there might be something else going on in terms of their metabolism that is preventing them from losing weight. I will say though that they are probably also seeing a lot of other benefits from exercise if they're doing it in a healthy way. And this kind of goes to the point about Laura's point, not necessarily diet, but when we talk about weight loss, I generally don't. So we talk about healthy lifestyles of physical activity and nutrition. And so healthy nutrition, not using that word diet, healthy physical activity. And so having them focus on some of the other benefits, which may be improved mood. So they might not be losing weight, but they may see some of those other benefits. They might see improvements in cardiovascular fitness. So their health outcomes are better, but it might not just be a weight issue.
And I think going off of that, just briefly, you know, someone who's working out could be building muscle, and that doesn't always translate to, like, you know, your overall like fat to muscle ratio when we're talking about weight and stepping on a scale. And your muscle is going to burn calories differently than fat may within your body. So sometimes it's not always, as she mentioned, like a direct correlation.
And again, Pam, back to that issue that they're not eating enough calories, that, and again, this is more Dr. Brown than me, but you send your body into that starvation mode, and so you actually lower your basal metabolic rate. So then you're burning less calories when you're just sitting. And so again, it kind of, if you're not eating enough, it throws your whole metabolism into kind of shutdown mode. So that might be another issue for that individual.
Are there any other questions? I know we're a few minutes over, but we do encourage everyone to check out our website and our YouTube channel for these recordings and any other information. And you can always contact us if you do have any other questions about specifics.
Thanks, Katie. Everyone have a great weekend, and hopefully we'll see you next week.
Thank you, everyone.